Both overall survival in both arms are equal, but for the patient who has PD-L1 expression positive, they got significant improvement in overall survival. At subgroup analysis, or the patient who received cetuximab in the first line got non-significant improvement in overall survival, and the patient with negative B16 virus infection also got non-significant improvement in overall survival. Based on that, the ISMO recommendation recommended using either Nivo or Pembro as standard treatment if the patient didn't receive immunotherapy in the first line. But for the patient who received immunotherapy in the first line, still the standard of care is single agent chemotherapy. The take-home message: in first-line setting, immunotherapy, pembrolizumab alone, or in combination with chemotherapy, platinum 5-FU, significantly improved overall survival over extreme regimen in patients with PD-L positive disease, and it's currently the standard of care. In post-hoc subgroup analysis, immunotherapy alone, or in addition to chemotherapy, didn't improve overall survival in patients with negative PD-L1. In the second-line setting, Pembro or Nivo improved overall survival over the single agent chemotherapy, especially in patients with PD-L1 positive disease. Let's go to the nasopharyngeal cancer. The NCCN guidelines still consider the chemotherapy the standard of care in these patients, cisplatin plus gemcitabine. Also that there is 3 new immunotherapy drugs coming from China. These 3 drugs tested in China, not worldwide, and actually showing very promising results. The 3 drugs are currently approved in China as a first-line treatment for patients with metastatic nasopharyngeal cancer. The first one is toripalimab. The toripalimab has been added to the gemcitabine cisplatin versus the standard of care placebo and gemcitabine platinum in phase 3 trial included about 300 patients. The incidence of grade 3 or more toxicity was equal between both arms, and there was improvement in overall survival and progression-free survival among the patients. However, this is a recent trial. No long-term follow-up was done, and it's considered a non-universal trial. It's just a Chinese trial limited to the Chinese people. The pembrolizumab is another PD-1 inhibitor tested in the same way like the previous drug and give also the same almost improvement in progression-free survival. The third one is the tislelizumab, another drug, the same family, anti-PD-1 antibody, also tested in the same manner and showed improvement in progression-free survival, but this
only abstract.
Was just in abstract form, not in full abstract, full paper publication. Based on that, the ISMO recommended the cisplatin and gemcitabine as the standard first one with recommendation type A, and alternatively they recommended using either pembrolizumab or toripalimab in addition to the gemcitabine and cisplatin as category B recommendation or category 2. What about the second line? Pembrolizumab has been tested in the second line for nasopharyngeal cancer against the standard of care single agent chemotherapy in phase 3 trial, and actually this trial was a negative trial, showed no improvement in overall survival when Pembro was used alone versus the standard of care chemotherapy, with almost similar objective response rate. However, the toxicity was much lower for the patient who received pembrolizumab. Additionally, the Nivo was also used in phase 2 trial actually. It was a single arm trial, phase 2 trial. It showed activity in this situation. The about 80% of the included patients in this trial was having non-characterizing squamous cell carcinoma. Because of this, the recommendation come after that to recommend nivo only in the patient who has a non-characterizing disease. The overall response in this trial was about 20%, and about 20% of the patient was able to receive treatment more than or maintain on the treatment for 12 months or more. That means we have some durable response in about 20% of the patients. The survival at 1 year was about 60%. The take-home message for patient with for nasopharyngeal cancer patient, in the first line setting, chemotherapy alone is the standard treatment. Adding toripalimab, pembrolizumab, or tislelizumab to the standard of care, gemcitabine, platinum is a promising strategy, but missing the international validation and long-term follow-up for now. In the second line setting, single agent pembro, nivo, or toripalimab is associated with relative good oncological outcome, but not better in survival. The good thing here is the better tolerability, toxicity is much lower if you are going to use immunotherapy. But of course, the cost will be much higher if you are going to use single agent immunotherapy here without strong evidence or even benefit in the term of overall survival. That's it. Point. Thank you.